There are two different types of arthritis. Dogs may be born with a congenital problem, such as canine hip dysplasia or elbow dysplasia, and demonstrate early signs of arthritic changes. These changes typically occur before the dog is 1 year of age. Secondary arthritis may occur after the age of 1. We'll discuss causes in a moment. Dogs diagnosed with arthritis or a congenital problem can still participate in many activities with minor modifications to their life. The diagnosis by no means necessitates termination of activities. Many dogs diagnosed with arthritis early in life have wonderful, happy, and active lives. Causes of arthritis. Aging. This is the most common cause of arthritis, and most dogs over the age of 7 or 8 have some degenerative changes in their joints. Congenital problems. Hip dysplasia, elbow dysplasia, osteochondritis dissecans. Trauma to an area. Old injuries or repeated trauma to an area can cause an early onset of arthritis. Injuries. The cranial cruciate ligament stabilizes the stifle or the knee, and ruptures or damage to the ligament leads to an earlier onset of arthritis. Unhealed injury. An area that has been injured and has not been given the time to heal can lead to an earlier onset of arthritis. Obesity. Overweight dogs place a significant amount of stress on their joints, and this stress can cause secondary arthritis. Working and performance dogs. These dogs place more stress on their bodies and are more likely to suffer injuries that are not recognized. Untreated injuries and problems can lead to an earlier onset of arthritis. Metabolic diseases. Diseases such as diabetes or Cushing's disease are associated with an early degeneration of the cartilage and secondary arthritis. Dogs with osteoarthritis will go through good and bad periods. They will have flare-ups or periods during which they have an increase in symptoms. They will also have periods in which they will be symptom-free. During a flare-up, it is important to treat the dog appropriately with rest, modalities if necessary, we will discuss these treatments later, and medications if necessary. Continuing to exercise a dog or compete in a canine performance sport with a dog that is in a flare-up will cause additional problems. It is crucial to understand that if a dog is limping, the muscles effectively shut off and more problems will occur. Do not ever exercise or compete with a limping dog. Wait until the lameness subsides and any pain and inflammation is gone. Now let's talk about some of the symptoms to be on the lookout for and to discuss with your veterinarian. Stiffness, especially upon rising from a sit, after inactivity or first thing in the morning. Decreased activity level. Avoidance of certain activities such as going up and down stairs or jumping into the car. Lameness or limping. Pain. Many dogs do not outwardly express pain. Signs may be subtle, such as avoiding being touched in the area. Muscle weakness or atrophy. Licking or biting at the affected joint. Seeking cool or warm places to lie down. Avoidance of the affected area being touched by a person. Increased aggression with other dogs, especially when the other dogs approach the affected area. A preference to sit or lie down rather than stand. Increased sleeping and resting. Decreased appetite.